Welcome back to AM Northwest. Are you afraid you'll never win the battle of the bulge? Well, here to explain how a medically supervised weight loss plan can help you not just lose weight, but keep it off. We're happy to welcome back to AM Northwest from Aesthetic Medicine, Dr. Jerry Darm. Nice to have you back.
Thanks, great to be back.
Okay, you know what? I think a lot of people still this time of year, they want to lose weight, and it is tough, especially as you get older, tough. And why is it so important to have a medically supervised weight loss plan?
Well, our average patient loses 40 to 60 pounds, and that's really unheard of in commercial programs. The average in a commercial program is probably about 11 pounds, a number of studies have shown, and that's regained in a year. So 40 to 60 pounds, first of all, is a dramatic and significant change. All of our patients lose weight. Virtually all of them lose weight that come to us. They don't all keep it off. But they lose weight.
Because there's two components there, isn't it? One, losing the weight, understanding
part,
the physiology,
and then the maintenance.
And the maintenance, is that lifestyle change and understanding?
It's a lot of things. It's exercise, one. If you walk 3 miles a day, that's a 30-pound change in your life. And so the problem is, if that's all you do, it takes a year or a year and a half to lose the 30 pounds, and a lot of people lose interest during that time. And so there's the fasting component, the shakes, basically, and a couple, 3 shakes a day, eating 1 meal a day, for example, in the maintenance program. That's worth another 10, 20 pounds.
So understanding calories in, calories burned would give you a net effect. But the medically supervised component comes in with some chronic health issues, right? Diabetes, high blood pressure, cholesterol.
We see diabetes. A lot of times we'll see diabetes disappear within the first 2 to 4 weeks with the drastic changes that we make and they're drastic. I mean, people go on a food holiday, you know, it's shakes only for 3 to 6 months.
But if somebody were to try this unsupervised, they may drop. They may be successful in drop pounds,
but they can get in trouble though
because
of the we have to change the medications on a weekly basis. We have to change their medications. We have to reduce the amount of insulin they're taking, reduce the amount of diabetic meds, reduce the amount of antihypertensives that they're taking. So
for high blood pressure.
Correct. Yeah.
I read a medical magazine. I knew that was what it was. Let's take a look at a couple pictures here, because you've had several patients through the years.
So this is a gal who comes to us, and she's over 300 pounds, and her medical issue was that she wanted to get pregnant, basically, and she was unable to. And so when you increase weight, your hormones change, and it does a lot of things to you hormonally. In her particular instance, she couldn't get pregnant. Now, here she is, after losing over 150 pounds. And, you know, hallelujah, she's pregnant now. And, you know, that's what her doctors wanted her to do in order to get pregnant. She said, you've got to lose weight. And in fact, now she's pregnant.
She looks great. You also provide continuing education, follow-up, free classes for folks.
Our patients meet with a dietitian for an hour a week, and there's a series of 20 classes. So it's an educational component as well. That's the other component. And the last component that we bring to the table, in addition to the medical oversight, is that we use appetite suppressants. There are appetite suppressants that can be prescribed to certain patients that they can take long term. The state of Oregon allows us to prescribe those appetite suppressing medications long term. And so our patients, many of them have been on them for up to 10 years or more.
Very quickly, before we tell folks how they can find you, you're going to China to speak to medical groups there about weight loss and
weight loss, and of course the laser lipolysis, the lipo.
You invented that. That's your thing, right?
Well, I didn't invent it, but I perfected it.
Yeah. Okay. All right. Okay. Well, I didn't read that part. You helped to perfect.
I helped to perfect.
Very good. All right. Well, we'll have to talk more about that. In the
Thank you.
meantime, if you'd like to find out more about medically supervised weight loss or other aesthetic programs that may work for you, give Dr. Darm a call, 503-697-9777, and we'll have a link on our website so you can find it all there too. Good to see you again.
Nice to see you too.
Have a nice trip.
All right. Take care.
When are you leaving?
April.
Okay. I'll see you again before that.